Welcome to Fierce Fit Feminine and Other F Words. I'm Christine Brunelli, and I help women unstuck themselves. F is for fertility, except this episode is not just about fertility. We have some flips and twists and turns in this interview that took me by surprise. It is longer than most of my episodes, but I would love to encourage you to hang in there because, boy, at about the halfway point, she threw a monkey wrench into the story, and I was totally blown away. We're talking near-death experience. Blown away. Okay, let me just tell you who we're going to be meeting today. Dr. Booseh Jafari. She describes herself as a feminine, fierce, fun-loving, multicultural, multilingual citizen of this world, married mother of two, a trained dentist, flight attendant who loves dancing, skiing, baking, and discovering new things. Are you ready to hear her story of fertility troubles and landing on the other side? Let's get started. Booseh, thank you so much for being here, willing to share your story. I know there's a lot of women that are eager to hear your story, how you went through it, and how you landed on the other side. Are you ready to share?
Yes.
All right. Thanks for being here. So take us on a journey. Tell us a little bit about before you met the man of your dreams. What was life like for Booseh? And then when you got married, everything about your dreams, hopes and dreams of building a family. Kind of take us on a little quick trip through that.
Okay. So I met my husband in Germany where I grew up. And we were both very eager to finish our career, education and get started on our careers before we even think of planning to expand our family of two. And I was very far away from really the desire of wanting to have children because I had grown up in an educated family and it was all about having an education. And that was basically the child that I was raising. So we decided, and he's very open-minded. So he was totally encouraging that and thought so too, that he wants to be finished with his residency and me with my dental school and everything. And so then he wanted to do his residency in US. And so we moved here to United States, and I followed him a year after I finished my dental school studies in Northern Germany and came here and did residency here and went through the exams and all the hoops that I had to jump through to get licensed here in the States. And so at some point, we were living really the life because we were living in Midwest and there was money and not much to do. So we did a lot of traveling together and enjoyed our lives. And so there came a time where we just decided, okay, we're ready for having a baby.
Oh, fun. So okay. That's how it started. So
that's how it started.
How old were you when you got married, and how old were you or how far into the marriage were you when you made that decision?
So we married when I was 25.
Okay.
And we decided to get pregnant when I was 34.
Okay.
Yes. So 9 years after.
Double income, no kids, living life, flying all over the world.
Exactly. All over US too, because this was something we wanted to get to know too. And so, that's what we did.
All right. So tell us now, you decide you want to start a family. So what happened?
So what happened is we did have a baby fairly quick after we decided. I got pregnant, a very smooth, beautiful pregnancy. And I delivered my son, my firstborn, in August of 2004.
Wonderful.
Yes. Then we moved to Washington State and we moved to Washington State and then we tried to get pregnant again. And that is when I truly had the desire to have another child.
Okay.
Because the first time came along so easy that I did not know anything about the struggles of wanting to have a baby and it not happening. Maybe if the struggle was at first, it would have been much easier for us to give up or relax or whatever they tell you to do.
Right.
But with the second child, I knew exactly what I want and what I'm getting into. So the desire was completely different. It it became almost like an obsession after a while because it just didn't happen.
Okay. Well, so how old was your son when you decided you wanted to have a second child?
Actually, he was about 2 years old.
Okay. So you're 36.
Yes,
And
2 years old. I'm 36. And that's where, of course, the rates of the pregnancy loss, the miscarriages start raising.
okay.
And so I had a couple spontaneous pregnancy losses. It wasn't that I did not get pregnant. I just had many pregnancy losses. To be honest with you, I have lost count of those.
Oh my goodness. And how long would your body hold the pregnancy before you would lose it?
About 2 to 4 weeks. I was so trained in this that I would immediately know that I was pregnant without even starting the test or anything. I could tell from my complexion, from the way the skin felt, and just the eyes. I could tell. I could look in the mirror and tell that I was pregnant. And then I would do the test and it would come up positive. And then a week later or so, I would have bleedings. And so it was mostly between 2 to 4 weeks, what they call biochemical pregnancies.
Okay.
Then I think the longest I had gone was between 5 and 6 weeks.
Okay. And so this happened multiple times?
This happened multiple times until we started seeing an infertility doctor. And we were back then still in Midwest, actually. I now remember. We started kind of the step 1 of treatments, nothing serious, just Clomid, what they give you to ensure the release of egg and things like that, and watching the diet and do this and that and make sure you are good with exercise and healthy living, which I was always careful, but I was then on my guard. But then we moved to Seattle and I continued the infertility treatment at the Seattle Reproductive Medicine at Westlake.
Okay.
And then we dived into the journey of IVFs.
Oh, wow.
And I went through that procedure twice, which was absolutely devastating. I have to say, it is like something because you build up hope and everything is so well monitored and it is incredible. And every single aspect of your life is just dictated by that.
Oh my goodness.
Not naturally, but from yourself. I mean, you think all your decisions are in the shadow of this, wanting to get pregnant.
Yeah,
And
so can I pause you right here? Because I have a couple of questions.
Yes.
I have 2 questions. The first one is, I had a miscarriage. I have 2 children, so I had a miscarriage in between my first and a middle child. It would have been a middle child. So my son was about 18 months old and I lost a baby at 9 weeks. I was, my hormones must have, I never felt that baby move. I never felt the baby kick, but I was devastated and I wasn't even looking to have a child at that point. Right.
Yeah.
My hormones were so all over the place that I grieved the loss of this baby. And I'm wondering, with you going through so many losses, did you go through that? Did you feel like you were losing your mind because you were
Absolutely. Okay. Absolutely. And every woman does. And I tell you, Christine, ever since I have experienced that, I have so much understanding. Every time I hear somebody had a miscarriage, it is like really the insides of me start shaking because I know exactly it is something completely out of control. And
I felt
no
ridiculous.
One knows.
Yes, I felt ridiculous because I thought I didn't even have a chance to connect with this baby. And I was crying like at the loss of it. And it's the most, and I'm coming from someone who was not longing, right? I already had a baby. I was not trying at the time, but wow, my emotions were everywhere and I couldn't control it. And so with you having multiple, I'm blown away by your resilience of going through that multiple times. I'm blown away.
And you say that. I am blown away by the resilience of women who have felt the child kicking and moving. And I can't even begin to imagine how that is like. No. Pregnancy loss at any stage is horrible. But I believe the further you are, the more devastating it must be.
Must be. Agree.
So yes.
Okay. So then my next question, and this is my lack of understanding when you get into fertility. You were
Yes.
not infertile. You were able to conceive. So why did you seek fertility treatment? Because it wasn't that you weren't fertile. You just couldn't hold or maintain the pregnancy. Is that what you do? If that's your case, your
Correct.
situation? Okay.
Yes.
So obstetricians say, this is not my specialty. You need to see a fertility specialist. So it's not. So that's what happens, because there may be someone listening that's going, I'm having miscarriages. I can't maintain a baby. My obstetrician just says, try again, but I'm getting pregnant. So I'm not infertile. It's that my body doesn't hold the baby. So fertility specialists also specialize in sustained full-term pregnancies. Is that right?
Correct. But as I believe, as soon as you have like a 3 months pregnancy, so if you come past the 3 months, they do refer you to a general obstetrician.
Okay.
You can still see the infertility doctor, but the reason you go back to your question, to the infertility doctor, is because they are set up to do lab work, and they are just doing this to rule out all kinds of reasons, not just by the female, but also by the male, to make sure that there is nothing else that is interfering with this process.
Got it. Okay.
Yes. So they can prescribe medication to have, or just go all the way to the maximum, to the IVF treatment, which is basically the conception outside of the body and implantation of the embryo.
Which is what you did 2 times.
Yes, which is what I did 2 times. And I do remember there was this one time, 4th of July, we were at the Gasworks Park over in Seattle and celebrating, and there were fireworks, and I'm looking over the lake to this fertility center and thinking, look over there in some petri dish, are my embryos waiting to be implanted in my uterus. It is so absurd, but these are, the advances of medicine. Yes. And unfortunately, none of those tries took, and I did end up having a miscarriage both times. The first time, I think they implanted 1 embryo, and the second round, they did 2. Even counting with the risk of twin pregnancy, it just did not happen.
Oh my
Very,
God.
very devastating, because you have to go through a complete hormonal therapy before you actually get to the point of extracting the egg and fertilizing it outside of the body and things like that. I mean, all has to be timed. You can't be out of town. You can't be, certain times of the day you have to give yourself hormone injections. And I mean, it's a whole process. It's a whole process. It's been times that I have disappeared in tents by camping, just catching up with some hormone therapy and things like that. It is, looking back at it, it is very absurd, but it is what one goes through everything to make it work because of that desire.
Okay. And I know from someone that I know personally who had trouble getting pregnant in the first place. She tried fertility treatments and was telling me the cost, the financial burden, along with the emotional burden. And I know this was a while ago for you, but this is something that some insurance, I know people had trouble getting insurance to even cover this, and they had, they were going in debt trying to create a child.
Yes, I have heard those stories too. A lot of people go through that. That's actually something I have been blessed that I didn't have to worry about because of our background and the fact that we had saved and waited, and so we could afford. But it is very devastating that all of a sudden,
so it is an out of pocket. Is that right? It's an out of pocket.
Completely out of pocket. Yes, completely out of pocket. It's about every infertility treatment, when it comes to that, is somewhere between, when you go to those levels of lab work and even to IVF, ends up being between, back then at that time was at least like that, between $5,000 to $20,000.
Yeah.
Which is the full IVF. And it is just devastating.
And so you do that 2 times and you lose both babies. And so you lose $40,000 and 2 babies. So, you have devastation from every direction.
Yes, that's correct. It's hard to describe, really. Everyone has to have gone through that. I'm sure if you have listeners that have gone through that, can very well relate to what one goes through. It's very, very hard.
Before we get into your next step, can you describe or tell me a little bit about how you were feeling about yourself as a woman at this point? Did you have any, your career, you're successful, you already have a child. Did you have any points where you thought something was wrong with you? Like, did you ever self-doubt? Did you feel defeated? Or did you just press on? What was your emotional, mental health like at this point?
I think, and this is what I want to say, it's that I did not accept, I always tried hard for whatever I want to achieve. It was just with me and my husband, both of us. And this was pretty much the first time that I had realized in my life that no matter how hard I work or how much I give, this is just out of my hand. It's not happening. And that feeling was devastating. It's like a certain sense of pride and achievement. So I was broken in that point. I never doubted, like, oh, my body cannot do that, or what is wrong with me, or anything. It was just a question of why.
Yes.
What happened, and something that I couldn't explain no matter how much I read. And God knows I read a lot of literature about this during that time, but I could not grasp this. And that was really hurting me at a different level, not accepting that I can't make it happen no matter how hard I try.
And did the obsession with trying to conceive your second child affect your parenting with your first one at all? Did you ever feel like your mind would go away? Did you feel like you could be present with your firstborn, or did you feel like just totally sidetracked with this whole obsession of trying to get pregnant?
It actually did not affect it that much, even though I was thinking about it often. I was really cherishing my time with my firstborn because I knew how precious that is. But there were times that, let's say, we were in a museum one particular day, I remember we were in the children's museum in Bellevue, and I received a phone call from the SRM telling me that the pregnancy test was negative after one of those tremendous treatments. And I just was, I don't know. I just felt like, okay, we need to leave and go home to get over this. And I felt that. I tried not to show it, and we continued because, I had a small toddler. And so, but I felt that. And it affected the way I would dress. I would just deal with things. Everything in life is in shadow of that desire. It is just an influx of emotions that one can't even describe.
Wow. It is really amazing when I think about all that we do if we have a child already, and the things that we juggle, the plates that we keep in the air, trying to keep our children happy, healthy, fed, nurtured while we're dealing with this emotional stuff. It really is the most difficult job in the world, being a mother. But
yes, it is actually magic. I think
it is
magic happens.
Yes.
There must be some,
it's a gift.
Defenses. Yes.
It just happens. So now you've done 2 fertility treatments, or IVF treatments, sorry, and you've gone through multiple losses. Is there, I know you have 2 children, so I know there's a point where this turns. Can you take us on the next part of your story? How did that happen?
Yes. So what happens was I had also several DNCs. I had to have DNCs. These are a dilation and curettage of the uterus. It's a procedure to remove remaining products of conception.
Okay.
After you have had a pregnancy loss, you are supposed to do an ultrasound, make sure that the uterus has discharged everything. And that the endometrium is clean. So there was this one time that it was Mother's Day, and I postponed my DNC because the doctor had prescribed it, and I had asked if I could travel to East Coast and then come back and do the DNC procedure, and she was okay with it. So I left town and I came back, and for some other reason, I postponed it again. And then one beautiful afternoon in April, where I had purchased strawberry plants and wanted to plant them with my son, I felt very tired and told him that I will take a nap and he can play Legos right next to me until I get up, and then we can go plant the strawberries. And so we were in bed, and I woke up from a nap in chill and sweats, and was feeling terrible. I was so cold that I just kind of crawled to the kitchen and made boiled some water and started drinking it, but I couldn't even stand. My son was about 4 back then. And he was just playing happily with his Legos on my bed. And he did realize I'm not feeling well. But, I think at that age, you don't realize. He may have asked me how I am. And I said, I'm okay. And so I crawled back into bed. And I then called my husband, who was about to board a plane to Chicago to give a lecture. And I told him that I am feeling miserable and I'm so cold and I can't even focus, and things were coming in and out. It was getting dark in front of my eyes. And so he said, okay, why don't you call 911? Everything was taking too long for me.
Okay.
So I got very impatient and I said, okay, and then let it go. And then I fell back to, I don't know if it was a nap, it was a trance moment. And I did call 911. And again, the phone call, the lady who answered the call, I felt like she's taking too long. Everything was just stretched, but then she was trying to keep me on the phone to get the information out. And
right.
I do not remember if it was me or my son who gave the address.
Oh my God.
I do remember that the phone fell from my hand into the sheets of the bed and I couldn't find it anymore because I could not keep my eyes open. And then I don't remember anything. Next thing I remembered was somebody was in the house. I heard some male voices. And next thing I remember was me being in an ambulance and being in the most serene state I've ever been in my life. It was... I just felt like everything is fine and I need to just rest. And I was seeing a very bright light. I was seeing my dad, who had passed away years ago, and some of the friends who had passed. It was a beautiful sight I saw that I wanted to go to. And I was getting constantly interrupted by this gentleman, the Mukilteo Fire Department, that was yelling at me and telling me, asking questions. Where's your husband? What's his phone number? And I thought I had already told him the phone number, but
right.
He wouldn't let me just be at peace. He would just bring me back to this agony. And I was getting so angry with him. And I said, I need to rest. I need to go. Just leave me. And actually, I did tell him that I'm making an important decision and he needs to be quiet. And I do remember that. And upon that, he yelled at me. And he may not have yelled. I don't know. That's how I perceived it. What I remember is him yelling at me, telling me that I have a 4-year-old son and I have no right to decide any of this, and I need to stay with him. And he would just shake me and say that I need to stay with him because this is none of my decisions, and I need to be with him, and I have a 4-year-old son. And he would just bring me back to the reality of what is here, and that is, I believe, what kept me on.
Okay, you have totally shocked me. I had no idea, none. I'm hearing this for the first time in my life. I didn't know this part of your story. So, okay, I have so many questions. First, when they came, what did they do with your son? What happens in that case? Did he ride along in the ambulance? Did they?
No, they knocked at the next door, my dear neighbor next door, and have had her take my son in.
Okay, so he's safe.
Close the door. So yes,
okay, he's taken care of. You're in the hospital having a near-death experience.
I was in ambulance having a near-death experience.
In the ambulance.
Yes.
Sorry, that's what I meant to say. You're in the ambulance and this is so fresh on my mind because during the pandemic, someone said to me, Christine, you have to see this show, Surviving Death, on Netflix. Just watch the first season or the first episodes or first couple episodes or something. And there is the whole thing was about people that described exactly what you're describing. If you haven't seen it, you need to see it because you'll go, oh, that's
I have not seen.
You just described every single person from all over the world in this documentary.
No way.
They've never met each other, all saw a light, all felt peace, all felt serene. They all saw someone they lost, who they loved, and they didn't have fear about leaving. They were ready, like they could have, but they came back and they're here to tell their story, but also coming back. This is little off the subject, but the therapy. There's a woman in Seattle that does therapy for these survivors because they have guilt. Sometimes they were in a multiple car, people in a car crash where multiple people passed away and they didn't, but they had that experience and they're still here and they struggle, or, just different things. And the woman in Seattle is counseling them on transitioning back to Earth, because they had this experience. So I'm sharing that with you just because you have brought this all back to the surface of me watching, realizing now after watching these, if you haven't seen it, if you're listening, if you haven't seen it, just watch the beginning because it describes Booseh's experience to a T and the peace. And so you did feel the serenity of that.
Yes,
feeling.
yes, absolutely.
But you also felt the challenge of wanting to be there and here at the same time because of your son.
Well, he reminded me of that. I wasn't thinking of anything at that point. It was just also beautiful that I wanted to go to, but he brought me to this. And then I saw a vision of my husband and my son standing at the entrance door at the house. And there was like this strawberry light that sometimes in April comes in Washington. And I saw them and we were getting away from them. But that never happened because my husband wasn't home at that time. So it must have been something in my imagination. I was leaving them actually.
Wow.
That picture. So
and what was this? What were you suffering from?
I was going through a sepsis. So the uterus had infected, the remaining product of conception remained. That's why one needs to go through the curettage and remove that. Otherwise, they can be because they don't get nutrition because the pregnancy has been rejected.
Okay.
So the endometrium has this remaining products of placenta and fetal products that is remained there and can get infected. And so in that case, my uterus had turned into a big abscess itself.
Oh my goodness.
And that had gone to the blood and I was in septic shock.
Oh my goodness.
In the full form of it. And so, this is what it was.
Oh my goodness. So how long were you in the hospital?
So my husband did not board the plane and he just returned and started driving, as he described himself, like a madman, over to the Providence Hospital in Everett, because that's where he learned that I would be transferred to.
Okay.
And so I was there at ER and the doctors it was a very, very strange period of time for me. I should have back then written all the details about that because I was seeing things that are very absurd to me right now, like the nurse talking to me calmly and suddenly the layers of her tissue in her face were being peeled out. Like first her skin was gone, and then could see all the fatty tissues, then those were gone, and I could see all her muscles in detail. It was like this anatomy books that you take each layer away for learning. I was seeing her in that, and she would then she was a skeleton. I was in septic shock with all the...
Oh my goodness. So the hallucinations,
exactly. I do remember this part that I stood on the bed and told them that something terrible is coming and they need to prevent that. I think then I saw a police coming in and then I was just in and out. But my husband said later that when he came to the clinic, that I was bound to the bed. So they could not keep me still. Apparently, it was that bad.
Wow, you're a little firecracker.
Yeah, I was apparently. And he just had walked into ER, which you can't just walk into the
Sure.
ER, into the treatment room. But for some reason, was it, I don't know, fate or whatever one wants to call it. He had walked in there and had realized that they are trying to set up for all kinds of drug testings. Because this is what they see most when people are in this state. They have taken some drugs and
oh my goodness, they don't know who you are. They don't know your
they
background.
don't know anything. They couldn't ask anything of me. And they were just, the doctor who was there was just giving this orders. And my husband, and this I hear from my husband, that my husband just was begging him to do whatever tests they want to do, but do start me on antibiotics as soon as possible, because he just had, I guess he had put one and one together in his head and come to some sort of, because he knew I'm not taking drugs.
Right.
And then the doctor has been trying, or the nurses have been trying to explain to him that not all husbands know what goes on at home and they do need to do this drug test. And he had said, do, for God's sake, whatever drug test you want to do, but she must be on antibiotics a while ago. She must have been, because this looks like sepsis to me for an infection. I can't explain it, but she had some pregnancy losses. Maybe it's related to that. So that convinced the doctor. My husband says he looked at me for a short moment and just made a split-second decision to listen or not. And that is basically what saved my life.
I have goosebumps. I have goosebumps.
Yeah, I do get tears in my eyes.
And your husband, you should probably share a little bit so the listeners know your husband is a physician. So can you tell a little bit about him and what he does for a living?
Yeah, my husband is a physician and he is in the field of oncology. So not only that, he's just passionate about medicine and every branch of it. So he has not learned it just as a profession. It is also his hobby, his life, his everything. So he has
blessing. What a blessing that he did not get on that plane.
Yes.
I mean, this could be a movie. I'm seeing a movie unfold as you tell this story of, you and the 911 and the phone dropping in slow motion into the sheets. And, I'm kind of, we're both giggling, but at the time, this is serious.
This is very serious matter.
This is fatal, right? If you had not been called in time, this would have taken your life.
Absolutely.
So, how long were you in the hospital?
I was 2 days in hospital. I was first at the critical care, and then they put 3 different antibiotics IV on me and decided that I need a surgery. The uterus needs to be removed ASAP. And the doctor who was on call to make this decision and perform this decision was postponing it, because she knew that the fever has to come down. I need to come out of this hallucination state. Otherwise, she will be doing surgery on somebody who is basically lost. And these are things in medicine, you decide not to do that. She was waiting for any sign of improvement so that she can perform that. And she herself was in late stages pregnant. At some point, they decide, because my husband was literally begging that I will be taken to OR. She finally came and agreed to that. And I was completely out of it. So I have heard all these stories. And it must have been after midnight. They had to call an anesthesiologist from home. And my husband basically, she had told my husband that she will do what she can, but he knows what the outcome of this kind of stuff can be. And so he was left in the waiting room there, and the sleepy anesthesiologist and the pregnant OB went to OR with me. And she did tell me afterwards that as she was looking into the uterus, she felt like it is just as thin as a blown balloon. And that any moment she could see the other side of the uterus. She said, I could see the other organs through the wall of the uterus. That's how thin it was. And so she had just made a decision on her own. I do not know why she made that decision. Was it because she was pregnant? Or was it because she just thought, I am young enough? I do not know, but she did not remove the uterus. She just basically drained it. She did a very difficult DNC.
Okay.
Of the wall, of the endometrium, because the uterus wall was so thin, and she said any moment she could have poked through.
Wow.
They took me out of OR and I actually made it through.
Amazing.
Yeah.
Amazing. And I'm sitting here thinking, you have another child with a uterus that's as thin as a balloon when it's inflated.
This is the miracle. This part is the miracle of my life.
Okay.
Because the story goes on as such that after that incident, and everybody who has gone through a near-death experience, although not maybe everybody, what you said is such happy ending, I was completely delirious after I survived that episode. I was not with my feet on the ground. I was just at least 2 inches walking above the ground. Everything was possible. Everything was possible for me. It was just such a feeling that I sometimes close my eyes to kind of imagine how that kind of feeling was. The ultimate feeling of gratitude, happiness, thankfulness, appreciate life, and what we should be in all the time. That state.
I love this. Yes.
I mean, that state of life is something everybody should be in at all times, and yet we can't.
Right. You don't get a near-death experience. Not everyone gets that, to taste what it's like to get to be here, that it is a gift to get to be here.
Yes,
and
it is.
Wake up another morning. Not everyone gets that opportunity. So you had you feel a tangible sense of gratitude because
absolutely. It is indescribable again. And I have to tell you that I had started with the recommendation of Dr. Klein at Seattle Reproductive Medicine that I need to see a counselor regarding all these pregnancy losses. And this was one of the best advices that was given to me in my life by a very wise woman. So I started seeing somebody who she had recommended. I didn't think much of it at the beginning, but she ended up being really a very important person in my life, that therapist, Lynn Tanis, who is retired meanwhile. And so our sessions of pregnancy loss and talking about that turned into near-death experience therapies.
Wow.
And she has helped me go through this. She has described it all to me and taken it apart for me and helped me to get back to real life. Just one step at a time. She is a very, very important person in my life. She may not know it herself, but it is the truth. The counseling throughout all these struggles is so important. I can't stress that enough. This is one of the reasons I like to share my experience, because the times have changed and the counseling basically rescued me throughout it all. And here I am. Because of that, being talk about it and even smile and giggle and laugh about it. It truly is. And not that it has not left a mark, it has. But at least I have been able to put the pieces together. Yes. Even cracked, they are glued together and are holding up.
Oh, and so I hear you and I hear what you're saying. So if you are listening, she is saying, if you've lost babies, if you've lost, if you're having fertility issues and you're grieving, get help, get mental help, see a therapist, because it does mess with you emotionally. I mean, I can't even begin to understand where you were. So I'm so grateful that you shared that, because I know that there's not a stigma anymore with having a therapist. If we have a personal trainer at the gym, we can also have a personal trainer for our brain and our mental health, right?
Yeah.
And I think it's so nice that we've finally broken through that barrier. So I agree. Yeah. Get mental support, get some help, and don't try to power through it on your own, because it can feel very lonely and you can feel defeated. So you got pregnant after this. I'm still like, how did this happen? Did you?
I really don't know. It was a spontaneous pregnancy.
You're kidding.
And yes. And so again, I had completely given up after this episode.
How
I
soon?
was
I have to know. How
very-
soon after the hospital did you conceive Ella?
I was in April in hospital of 2009. Ella was born February 2010.
Oh my word. She is
Yes.
a miracle baby.
Yes, that was a miracle. Really, what happened? It was, I had given up on pregnancy for good. I know I have faked that often before that, oh, I am giving up. I don't want to go through this anymore. I am happy. I have this, I have this. But it never happens. The desire of having a child, it just doesn't go away.
Right.
So, but after this near death experience, it did go away. It did go completely away to where I did not want to be pregnant. I did not want to have. I was like, this has happened. So I appreciate truly what I have. Not that I wasn't appreciated. It just, I would not let go of this one issue. And then apparently I had gotten spontaneously pregnant. And with me being so in tune with my body and knowing everything, I knew immediately. One day, looking in the powder room in the mirror, I was like, "No way! It is impossible." And then I started panicking, and I was like, "Okay, this can't be." So I was, I guess, denial. But then I had a wart on my foot, and I had gone to the local clinic to treat that. And I was explaining to my doctor that, because she was following up all of this, of course, that I have been very tired lately and this and that. And she looked at me and goes, "Booseh, why don't you go pee in a cup for me?" And I said, "Come on, we were back then on first name basis." And I was like, I know, that this is not. And she goes like, "No, I have to do that." And then the pregnancy test turned positive. And I panicked. Like I was like, okay, I need to have DNC tonight.
Oh, you were afraid to be pregnant.
Oh, I didn't want to. This was like a disaster for me. I was like, I'm not going through all of that again.
Oh, and at this point, you're 38. Is that right?
Yes.
Okay.
Exactly.
So this is high risk anyway, right?
Yeah, exactly. Exactly.
Okay.
So I called my husband. And my husband, again, on the other end of the phone line, he was like, "Oh, no. Oh, my goodness." And so we were like, here we are again, going through all that emotional. And so my mom was visiting from East Coast that time. And that evening I had bleeding. And I was like, okay, we need to do it. So I called Everett Clinic and scheduled a DNC. Because my mom said, "So why don't you do all of this now while I'm here taking care of Tristan, and you guys can take care of that. And so now you have help." So scheduled as soon as possible. And then the next day, I had a phone call from Everett Clinic telling me that they have reviewed the papers and they have noticed that they didn't have any ultrasound on file. Oh. And they can't legally do a curettage without an ultrasound of the file.
Okay.
They need to. So that I have to postpone it and I have to come in for an ultrasound. And I said, "Well, can I come now?" And they said, "Well, you can come today, but not right now." So they gave me a time and I was ready to go. And I called my husband at work and I told him that I'm going for this because they won't do surgery without an ultrasound. And he said, okay. He tries to be there. He meets me in Everett. And I said, we have been through this so often. I'm not even emotional about it. You do your work. You don't have to rush down. It's all good. I'm not emotional. I'll just go. Let them do the ultrasound. And I come. I don't even want to look or anything. So, but sure enough, he was there. So waiting for me in the room with the person who was doing the ultrasound, which was late hours. And so I came in and I'm talking to my husband about, because we had dinner guests that evening. We were talking about what was prepared, what needs to be done. And as she's doing the ultrasound and we are both even not looking, we're talking about future plans. And then she says, okay, here you see the heartbeat and here you see this and here you see that. And
oh my gosh.
we both turn around and sure enough, I am over 3 months pregnant.
Oh my goodness.
And so we both basically froze. We just didn't know what to say. And there was this heart, something we had not, seen on the monitor.
Incredible.
It was, I just cannot describe to you. With both of us, we were frozen. And then she was like, and she didn't know, the ultrasound tech didn't know. She was like, oh, didn't you know you were pregnant? I was like, yes, but we didn't know that it's that far. And she was like, oh, yes, this is this many a week and that. And she described, she said, would you like to have a picture? And then she starts printing. And there we were sent home with a picture of the baby.
Oh, my
to
word.
Our dinner guests and my mom and Tristan. And that was Ella.
Incredible. And was the rest of the pregnancy easy?
Very easy, but a very big baby. Ella was nearly 10 pounds.
Wow. And you're a little half pint. You're just a little thing. So that's a big, big baby.
Yes.
Yeah.
That's true. And so I transferred my pregnancy care to Seattle to a doctor that was recommended again by my fertility doctor, Dr. Klein, the best surgeon apparently in the entire area, Dr. Heath Miller. Mm-hmm. And he monitored the rest of the pregnancy. And I had baby Ella in February 2010.
Amazing. And she is healthy and witty and brilliant and beautiful.
The gifts of life
they are. Oh my gosh. Okay. We have so many things that we've touched on today. We've touched on the pain and agony and the emotional, devastation of loss and trying and feeling like, we're in control of everything, but this one thing we're not in control of, and managing that. And you've touched on being a mother and all the things you have to maintain while you're so obsessed on having another child. And then a near-death experience. You just totally broadsided me with that. And I'm so glad you shared it. And I'm honored that you felt like you could share it here. So I want to just thank you for sharing that, because that's a big story. That's not something you've gone through all the therapy for it. So I know that even though you've gone through all the therapy for all of this, it's still difficult because you can relate and feel the pain of others, I'm sure.
Right. Yeah. Absolutely.
Yeah. And the miracle of getting pregnant when you're not trying, which, we could go on for another hour, because I'm sure you have a lot of people in the fertility world say, stop focusing on it. Stop focusing on it. Stop obsessing about it. It'll happen. And look, here you are not wanting it. And here she comes. Here, Ella, to your family. So Booseh, I feel so honored that you shared this with me.
Oh, thank you.
My listeners. And
I'm honored to be able to share it.
It is truly a story of persistence and determination. Like, you definitely exhibited being fierce. There is no doubt in my mind that it had a purpose to be here. Look, and now you're raising these two beautiful children and happily married to a man who is definitely dialed in. He just somehow you have a partner there that is outstanding, because he made decisions that needed to be made, but he had no idea they needed to be made until he did it. So he's definitely dialed into what needs to happen. And this story is incredible. What would you say to our listeners as we're wrapping up, if they're stuck in the mud of fertility, if they can't be, you're on the other side and you're getting to celebrate in gratitude of everything, but they might be in the mud right now going, it's never going to happen. My body fails me. This isn't meant for me, or whatever. And they're feeling defeated. Your story is so encouraging, but they might not be able to see encouragement or receive it yet. What would you say to that mom or potential mom or someone trying to be a mom?
Yes. God knows I have many things to tell to them, but wrapping it up, I have to say that everybody's journey is different. Everybody ends up somewhere else at the end of the journey of fertility, if it ever ends. I just know that it is so common. The prevalence of this is so high that every time I had shared my story in private with anybody, I get listen to you. You have had a pregnancy loss. It is so common.
Very.
So many women have had pregnancy loss and losses and have gone through that hormone roller coaster, and just move on and do as if nothing happened and pour all in themselves. So I think just knowing of that you are not alone helps a lot.
Yes.
A delicate period of time where you are trying to get pregnant or thinking about that, every word, every action, every food, every travel, every weather, every mood affects you. And not people around you realize that. And so maybe a message to the surrounding of these people, encouraging these people to share their emotions and others to understand it. And then what I think very, very highly of and think is the answer to many, many things is education. I think women need to educate themselves about their bodies, how it functions. It is an orchestra, a perfect orchestra of hormones, what happens in female reproductive system. And the more familiar we are with it, the better it is to understand why things happen the way they do happen. Or at least we can get an understanding of how it works, even if we don't, because we haven't discovered everything yet.
Exactly.
But it's a mystery. The female body is and remains so far a mystery, why certain things happen. And emotional and life circumstances influence all of that. It is something that we need to be aware of. And so one cannot give really an advice to somebody who has this big desire of having a child, let go or relax. None of that will happen. These are just words because it comes from within and one is helpless. But education is a very, very good thing that one can do. And I can recommend actually a very good book that was written by an author living in Seattle. Toni Weschler. The book is titled, it's a national bestseller, Taking Charge of Your Fertility. It is a very informative book. It is not just for people who would like to be pregnant. It is just a book that I recommend to all women, just to understand the way their bodies work and have worked in the past and will work in future.
I love it. I'll link that book in the show notes if you're listening, so you'll be able to find it, because I love that recommendation. Education really does help us at least process, right? It teaches us, but it also helps us process things because we have more understanding. And an orchestra is the best way to describe the human body in general, but the female body, oh my goodness, there's so many things at play. So I love that analogy. Booseh, I am so grateful that you spent this time with us today. That's a wrap. Thank you for being here.
Thank you, Christine. Thank you for having me.
I'm not a man hater by any stretch, but I will say women inspire me. We are stronger than we think we are. We can dig deep when we have to, and we power through all the bumps and bruises that life throws our way. And these stories just inspire me just to keep going. And I love knowing, like she said, we're not alone. I hope you enjoyed this story as much as I did. If you would like to reach out to me with any questions or comments, you can always reach me through email info@christinebrunelli.com or find me on Instagram and send me a private message there. If you like this episode, don't forget to hit subscribe so that you get notified the next time a new episode releases. And until next time, my friend, have a fierce, fit, feminine, and fabulous day.